Welcome to this panel at Africa Tech Fest, dedicated to the role of artificial intelligence in fighting COVID-19. My name is Max Smolaks. I'm the editor of AI Business, the publication dedicated to artificial intelligence. And I will be moderating this session and asking a few questions. Joining us today are Bruce Mellado, professor at Witwatersrand School of Physics and senior scientist at iThembaLabs. Hello, Bruce.
Hi, how are you doing?
We also have Dr. Ahmed Ogwell Ouma, Deputy Director at Africa Centers for Disease Control and Prevention.
Hi, Max.
And Precious Lunga, co-founder and CEO of Baobab Circle. And so could you guys please introduce yourselves and talk a little bit about, like what positions you at this juncture of sort of like, like COVID-19 and technology. So if we could start with Bruce.
Hi. So I will be speaking today in my capacity of a member of the COVID-19 Advisory Committee to the Premier of the Gauteng Province. The Gauteng Province in South Africa is the most populous province in the country, where the host Pretoria and Johannesburg. And we have about 15 million people. So our team has been leading the modeling efforts for the province that has been advising policymakers to deal with the crisis, in particular the first surge. And in doing so, we were able to implement artificial intelligence, machine learning into the modeling efforts that I would like to talk a little bit about.
Okay, thank you. And Dr. Ouma, I think, the notion of CDC is immediately familiar to anyone in the pandemic. If you didn't know what it is, you do now. But just to reiterate, so what are your responsibilities in your organization?
Thanks, Max. I'm Deputy Director at Africa Centers for Disease Prevention and Control, which is a specialized agency of the Africa Union. No relation to all the other CDCs you hear about. This is an Africa-grown, Africa-led public health emergency agency. And here, particularly during COVID-19, but indeed with all other public health emergencies that we deal with on the continent, we utilize technology as best as we can and wherever it is possible on the continent. So my role is really to guide and lead the technical teams that are out there dealing with various types of outbreaks, including COVID-19.
Thank you. And Dr. Precious, yes, so what is Baobab Circle?
So I'm the CEO and the founder of Baobab Circle, and we're a health technology company. And we use data to support people living with chronic health conditions. I mean, that's what we were really focused on, primarily diabetes and hypertension before COVID. And of course, when COVID hit, which we know actually affects people with chronic health conditions much more severely, we realized that we had to provide a service that enabled people to be able to identify where they are in terms of the amount of COVID that is area, and to also support them so they do the right things for their health.
Mm-hmm. So very, very important sort of like issue, because I'm a chronic patient myself, so I can relate. All right. Yes. Shall we start? What are the challenges of fighting COVID-19 in Africa that make the region different from Europe and Asia? I'm based in London, for example, and situation is very, very bad here. But they're saying that the virus is actually less deadly in Africa than elsewhere. So so what makes this geographic region different? Yeah. So sorry, if we could start with Bruce, I guess.
Well, I'd certainly like to quickly go through it. Obviously, we don't know a lot about the pandemic, but one thing is very clear is that the age profile in Africa is very different from the European, which has contributed to lower mortality rates. Currently, the mortality rate in South Africa stands around 2.5%, which is somewhat lower, and it has been attributed to that. But I think other panelists should be talking more about the global African picture.
Mm-hmm. Mm-hmm. So yeah, Dr. Ouma, yes. So what you're probably an expert on this. So what makes the African region different in terms of like COVID response and yes, I guess the infection rates?
One is the virus is the same. We've been doing gene sequencing globally, and in Africa we've done literally every other country has done gene sequencing of this virus, and it is the same everywhere in Africa and everywhere globally. So there's no difference in as far as the virus is concerned. But we are seeing a significantly lower picture in Africa, primarily because of three things. One is the expectation at the beginning of the pandemic is that Africa will just collapse under the pandemic. So the expectation was a collapse, but the reality is no collapse. So that makes a very stark difference, what we are seeing now and what was expected. And the expectation, in our view, was extremely wrong. Second is the way that we have responded on the continent. From the top levels, the heads of state have met 8 times now, particularly to discuss COVID-19 on the continent. So they are providing guidance. There's a lot of solidarity in as far as policy level coordination is concerned by the heads of states, by the ministers of the various sectors in a country. And we are coordinating these meetings that bring together the various countries and provide very good guidance on what we should be able to do. So solidarity and working together on the continent has been extremely important. Third is we started early, very early. As soon as the first case was identified on February 14th in Egypt, we went into action, and many African countries were in full lockdowns by the end of March or early April. So we didn't wait for the numbers to go up. We acted like we already had it within the community, and that kept the numbers low. And because the numbers were low for a long time, it meant that growth of numbers within the communities also came slowly. We did all the right things. We checked all the right boxes very early, and that is why the numbers are still lower compared to elsewhere. Discipline of the African type.
Yeah. Okay. Thank you. And Dr. Lunga, can you add anything to that?
Yeah, I just wanted to add that as well as the age profile, I think there's also the profile of the distribution of people. So many more young people in cities where you have a higher density of people. And so when lockdown was instituted, I think it also actually protected or shielded the people who are older and living in rural areas. I think that's also probably played a role. I also just want to add that it's true that in this phase, COVID-19 has had a lower mortality rate, but it's also important to remember that it's also about the long-term COVID, which can also affect young people. And that's a profile that we have to remember to keep an eye on and to keep tracking, because we don't know how this is going to evolve over time.
Yeah, absolutely. Yeah, one of the things that has been used to sort of face the challenges of COVID is artificial intelligence. This is a brand new tool in the arsenal. Didn't have it, during the SARS pandemic. Didn't have it before that. But now it seems it's being used everywhere. And the obvious use case for artificial intelligence is kind of like pharmaceuticals and drug discovery right now as we're searching for vaccine. But what about other ways to use AI? And this is where I'm interested to see what you've heard, what you've seen, how AI being applied. And I think, we'll start with Bruce again. So is it, if it's just not drug discovery, what other perhaps areas can AI be used in to help fight, the virus?
Right. So this pandemic has been a very intense experience in regard to data analytics, advanced analytics, and collaboration across disciplines. So I kind of speak about what we delivered in terms of implementation of artificial intelligence in regard to modeling of the pandemic, and how artificial intelligence helped and continues to help policymakers deal with the crisis. So one area where it was evident that modeling was going to have a very hard time using classical approaches to model and predict is the development of hotspots. Hotspots, as we know it, once they become prominent in a particular area, or they are more or less localized geospatially, they basically grow fast and create these big surges. And it's very clear that each hotspot is different. So what we decided to do is we basically go into the arsenal of artificial intelligence, pick the corresponding methodology and algorithms, and in particular, we used unsupervised or quasi-unsupervised machine learning in order to allow us to learn from the data as to how these hotspots evolve. And now we have a full-blown model based on artificial intelligence that allows us to describe and predict the evolution of hotspots. That's been particularly useful and as a particular showcase, something concrete. We also have used artificial intelligence in order to correlate the evolution of the pandemic with mobility indexes. Mobility indexes have played a very important role to understand the real situation on the ground. One thing is what policymakers enact, another is the adoption on the ground. They're two different worlds, so you need to somehow gauge the situation on the ground by looking at things like mobility. And we've implemented artificial intelligence to be able to correlate the evolution of the pandemic with mobility, and also with the economic impact, which is absolutely so now, and it's really becoming the center, or one of the epicenters of the discussion that we have right now. So I would say that AI has certainly made breakthroughs in terms of assisting policymakers with in addressing complex problems that are hitting the data.
Okay, thank you. And okay, go ahead.
Jump in there. I think an application that will see itself emerging is also, as we open up, we need to open up the borders for economic activity, and that links into what Bruce said about mobility data. I think it's going to be critical to be able to use that and to be able to use that across countries, so that we can have a clear picture, because we need to open up economies, because it's also important for well-being and poverty alleviation. So using the data from artificial intelligence and the modeling that will come from that in real time to be able to process data very quickly I think is going to play an important role as well across the continent.
Yes, and it's fighting basically two impacts of COVID-19, which is like the health impact and the economic impact, which yes, as Bruce said, might be as important, if not more important. And Dr. Ouma, so is AI something that's being discussed sort of like at the CDC level, at the governmental level, at the public sector level, as a way to fight COVID?
Absolutely, not just discussed, but we are using it as well. And on top of what has already been shared, I would like to add two things. One is around pathogen genomics. AI has allowed us to do very rapid analysis, and we can be able to actually tell countries where lockdowns are not working, because we can be able to compare the viruses that are in one side of the country are the same on the other side, and yet allegedly there's lockdown. And we share this with policymakers so they can be able to titrate and tighten their public health measures. The second way that we've used it is rumor. There's been a lot of rumors flying around, and we've been focusing on the ones that are in Africa. And apart from tracking the rumors, we are also providing the correct information. And on a country-by-country basis, on a sub-national level, we can also be able to track that. And without AI, it will take months to be able to go through the mountain of information on the internet, especially on social media. But with AI, we are able to do that literally on a real-time basis. So our communications colleagues can be able to tell me that right now, Africa CDC is the topic. And then we can be able to track what people are saying and about us, and we recalibrate our messaging around whichever topic that has come up. So these are two concrete ways that are actually being used at our level as Africa CDC, and we engage with policymakers in the various countries and other regional economic blocs, so that they are in line in terms of messaging with what we are seeing using AI.
Mm-hmm. I've got a follow-up question. So a lot of these initiatives, right, especially they involve collaboration between public and private sector, for example, or between the governments of different countries. And the data that's being shared is often patient data, right? That's pretty much the definition of personal data. So how do you navigate this question of sharing large amounts of personal data? And do you think, you know, like maybe a few years down the line, we're going to look at all this data, you know, flying around and going to be like, maybe we shouldn't have shared it? So you know, like, do you build in data protection kind of requirements and safeguards into these frameworks, or do you think, you know, like, we're amid the pandemic, situation is extreme, we'll sort it out sometime else?
Maybe I can start that. We are struggling with that right now across countries. No one wants to share their data easily because there's a lot of data protection regulations in each and every country. And we must navigate through regulation that is cross-border, and we are working on frameworks with different countries with that. And then the individuals also must be put in the picture, and we are encouraging countries to ensure that their local regulations and laws are known to members of the public, because it is their data that we are using, particularly when it comes to medical data. So at the continental level, we have frameworks that we are using, and at the national level, we are encouraging countries to let their citizens know what their rights are in as far as data is concerned. But we could never have gone this fast in addressing availability of vaccine candidates, for example, if we hid data from the beginning. We must give it to the Chinese that they provided fully sequenced virus very early in the pandemic, and that allowed for other countries, other regions to be more prepared and to begin the process of trying to get therapies and vaccine candidates onto the production lines. And this is a lesson that we must start ensuring that we have good infrastructure for sharing data at national, regional, and global levels. Because without that, we cannot be able to move quick enough.
Yeah, and just to add on to that, and the really great work that Africa CDC is doing around this developing these frameworks, is that it's also important to be able to distinguish what's important for public health, which is the aggregated data, versus the clinical significance, which is individual data. And my understanding is that many of these data sharing agreements is really about aggregated data, so it maintains the privacy of individual people while still tackling the pandemic.
Okay, thank you. And Bruce, I think did you have any comments?
Yeah, I can briefly share the experience we've had with this very sensitive problem. So one thing is evident, that this pandemic has caught different stakeholders off guard, in the sense that we didn't have a governance to deal with these very complex problems of data sharing, privacy, and obviously the legalities of it. So a lot that has happened because of the crisis evolving so fast has happened on the basis of certain agreements between certain institutions, governmental institutions, that we are a part of. Now, what is very clear, obviously, and teams like us that are developing modeling, we have to be extremely careful about the protection of the identity of the patients, the location. There's a lot of data flow and information flow that happens in a strict confidentiality and in a strict secrecy, I would say, to some degree. And then when we go to the public to share predictions and all that, a lot of the aggregation takes place, a lot of the summation of factors take place. So it's a very complicated question, but the crisis forced government and different stakeholders to basically come together with ad hoc frameworks that allowed us to exchange data. And this, I think, is a wake-up call for government to establish very clearly worded guidelines for future crises. This is not the last crisis we're ever going to have. And this is not the only type of sensitive information that we're going to have to process. So I think it's a lesson that we are learning. And as a result, and I can speak for what's happening in the Gauteng province here in South Africa, we're having workshops where different stakeholders come in order to shape that governance that will allow us to be more agile when the next crisis comes in.
Thank you very much. Okay, one of the things we have to discuss is the Africa Communications Intelligence Platform. And now, if our viewers haven't heard about it, it's a mobile data platform that delivers coronavirus-related information around Africa, created in partnership between the UN and a number of mobile operators, local mobile operators. So it has so far been introduced in at least 23 African countries, and that is just phase one. So why is this project important? And well, for many reasons. But yeah, if we could start with Dr. Ouma. So why do you think, like collaboration between telecoms providers is especially important now, in the pandemic?
It's a very critical part of the strategy to tackle a COVID-19 pandemic, and that is communication. Providing it in a way that reaches as many of the population as is possible. So this collaboration provides two very important aspects that have been brought together. One is the ability to deliver the message to the public, and that is where the telco companies come in. Literally every other person these days has a mobile phone. A vast majority have more than one, some more than two. So when you get the telcos infrastructure being able to deliver messages, and then you get the UN's messaging, good source, good information is then provided to the telcos companies, and these are then delivered to members of the public. It forms a very powerful partnership where information in real time can be able to reach anyone who has a mobile phone, including those who are around them. If I have a mobile phone and I get a message, I can be able to share it with my immediate community. So it is a very powerful partnership that brings together knowledge, and then that is being combined with infrastructure on how to deliver messages to members of the public. It is an innovation that I think is a good way to go, and we'll be able to open up in the future how to deliver messages to the public quickly and from reliable sources, and therefore cut off a lot of the rumors and misinformation and conspiracy theories that keep on flying whenever we have a crisis.
Yeah, absolutely. And probably, again, a follow-up question. So, Dr. Lunga, do you think the pandemic will accelerate the switch to mobile healthcare? Because we've all heard that, it's just the continent is leapfrogging technologies, and yes, it's now mobile first, and the healthcare is been in the middle of this transition. So, do you think by the end of the pandemic it's going to be 100%?
I hope it will be. I'll be very happy to hear that, because this is an area that I've been advocating for, to say we have the chance to do for health what has been done for financial services by using the mobile as a platform to reach people. And certainly, even with reaching people with the correct health messages to tackle misinformation, that's already something. Obviously, at Baobab Circle, we're going that step further and saying, we want to ensure continuity of care, because we're talking about COVID-19 and people who catch COVID and are ill and then die from COVID. But we have to remember that often in a pandemic, the indirect consequences of people with chronic health conditions being unable to access care can actually have even larger numbers in terms of illness and deaths that are indirect. So mobile health, digital technology has the chance for us to continue continuity of care of services, so that even when there's a surge, for example, people can still be monitored at home, can be brought into the clinic when needed. And we're seeing that certainly in our collaborations in Zimbabwe, in Kenya, and in other countries, we're actually seeing ministries of health taking this area really seriously and saying, actually, it's an opportunity for us to maintain the health of our citizens, and we can use the digital to reach many people with quality health access.
Bruce, what do you think about the sort of like the future of telehealth in South Africa, for example? You know, like have you seen things improving?
Well, it's very clear that this crisis has been a sobering example and a sobering experience as to how the importance of data, the importance of fast communication, the importance of gathering massive amounts of data for policy making and all that. And it's very, very clear that the adoption of mobile technologies and digital technologies take over more and more with respect to what we had before. And it's very clear now with adoption of contact tracing and the sharing of information between telecoms and government, all this communication. I mean, a lot of the barriers that existed earlier prior, they seem to be dissolving within the context of a new framework of governance. So clearly that's the direction to go, because it's in everybody's interest to streamline communication and data flow.
Okay, thank you. But you know, like this level of collaboration has obviously been brought on by crisis. You know, like we've got organizations pooling data, we've got public-private partnerships, we've got all of these beautiful things, but the pandemic, as you said, not going to last forever, right? So do you think we have a chance, and especially the healthcare industry has a chance to learn something about, you know, focusing its efforts, that if we don't, you know, like each do our own thing, if we just come together and try to solve one issue at a time, that, you know, like many things are possible that we wouldn't have thought are possible before, and you look across the world and you see that. So do you think, you know, like the healthcare industry can maintain the spirit of collaboration, you know, a couple of years down the line when COVID is history, we have a vaccine and everything is fine again? If we could start with Dr. Lunga, please.
Well, I very much hope in 2 years' time we'll have a vaccine and everything will be fine. I do think actually the practices that we have started now by tackling COVID, so having partnerships between governments and corporates and non-profits, I think those actually will sustain, because we are seeing the benefits of actually working in that way and realizing that no system can work in isolation. So I actually believe that there'll be sort of life before COVID and our working practices post-COVID, and that this change is here and will remain.
Mm-hmm. And Dr. Ouma, again, do you think like at least the level of international collaboration is going to persist? I mean, you know, like it's just like when every epidemiology sort of like national department knows the other department, you know, like do you think you're just going to be better positioned to weather any future pandemics?
Absolutely. And the quick example is the Ebola crisis in West Africa. We learned a lot from that. We have put into use those lessons during COVID-19 pandemic. And COVID-19 has made literally every other person start using the internet. And this is the beginning of trying to put artificial intelligence into better use. And those gains that we have made, I don't think we are ever going to drop those. We just want to improve on them so that we make things a lot easier for us in terms of preparedness and response. So I am quite confident that from here, we'll be looking for things that make our lives easier in terms of preparing and responding to pandemics. And our policymakers have also appreciated that utilizing technology is really a way of fast-tracking our preparedness and response activities. So we can only go further, and we can only get better from here.
Thank you. And Bruce, what do you think about the future of these sort of like private-public partnerships that are springing up everywhere? It seems, you know, like government is very generous. Sooner or later, that's going to be over, right?
Well, I think we need to start from the proposition that whereas policymakers and government understood the importance of data theoretically, it's been with the pandemic that people have realized at the upper echelons of government how important data is and how decisions have to be made on the basis of evidence. So now the buzzword is evidence-based policymaking. It's become, so to say, the center of this conversation. And accessing data, storing data, distributing data, and analyzing data now is becoming the center of this conversation for the management of future. So now, speaking, for instance, about the government of the Gauteng province, is now thinking, organizing workshops and thinking ahead in say how we're going to react to the next crisis. I mean, not that COVID-19 is over by far. However, take this momentum and these partnerships and this knowledge and these procedures and this governance that is being built in order to create a fast and streamlined response to future crises. And at the core of it is data. And that notion now is now entrenched among policymakers, much more than it was before the crisis.
Yeah. Well, it's certainly like a very interesting time to write about technology. It's an interesting time with healthcare. It's an interesting time in tech. So yes, but it looks like situation is improving. They're really sort of like, like we will have hopes for a vaccine, and I hope that like if we meet again for Africa Tech Fest, like next year, who knows? It might be physical again. But I'm afraid that is all we have time for today. Next, we will have a live Q&A with our audience. But for now, ladies, gentlemen, thank you very much for your opinions and your presence. And yes, good luck in your work. It's very important.
Thanks, Max. Thanks, everyone.
Thank you very much, Max.
Bye.
Everyone. Thanks, Bruce. Thanks, Dr. Ahmed.